Welcome to Health Talk with Dr. Almus McDowell, your guide to better living and natural wellness. Discover the power of alternative medicine, holistic health tips, and transformative practices for a healthier you. Join us on this journey to revitalized well-being.
Good day to all our viewers. It's a great pleasure to be here once again. This program will be speaking a little bit about inflammation. And many of you know that inflammation is a very, very serious condition. And so as we get deeper into this program, we'll tell you some of the diseases that are related to inflammation and what you can do to avoid inflammation. It is widely known that inflammation is one of the leading causes of diseases. And if you are suffering from inflammation, you probably would know that this condition or the symptoms that relates to inflammation is a very serious problem. And so we know that that there are many different health-related problems that are very much related to inflammation. And arthritis is one of the leading disease that are related to inflammation. So if you're suffering from osteoarthritis, it all has to do with inflammation, but at the same time, it may be related to degeneration of your muscles or of the joints, or inflammation around the joints that are causing the amount of pains that you probably might be suffering from. So in the case of osteoarthritis, that also again can relate it to osteoporosis. So it mainly affects more women than men, osteoarthritis, because it also can be related to low amount of estrogen production in the body. So lower estrogen levels, it means that you would have more arthritic condition in the area of osteoarthritis. So osteoarthritis is a very serious type of arthritis. So it affects the pelvic bone, it affects the knees, it also affects the shoulders, and so also can cause like a lot of lower back pains. So osteoarthritis is not just simple an arthritic condition that you might say, okay, look, I have arthritis. As I mentioned, the word arthritis should not just be classified as just one word, arthritis. There are many types, different types of arthritis. So we have osteoarthritis, we have rheumatoid arthritis, which I will speak about in a little bit, and then you have sciatica, which is also related to arthritis. You have gout, which also related to arthritis. Fibromyalgia, which is also another type of arthritis. So there's so many different types of arthritis that may be affecting someone and they do not know. So the reason why I want you to pay more attention to the type of arthritis you're suffering from, I will explain the symptoms you're having, and at that point, you probably can seek medical attention for your type of arthritis. Now, your doctor will be able to identify what type of arthritis you're suffering from. So in the case of, as I mentioned, osteoarthritis, you will have a lot of joint pains, you'll have a lumbar spine pain or lower back pains, you'll have shoulder pains and pains sometimes in the legs. That may be related to lower arthritis. And also, you may be losing some bone minerals. So it's called your bone mineral density. You might be losing all of that. So it's really important to understand your arthritic condition and not just generalizing everything under just arthritis, because I mentioned there are different types of arthritis. So rheumatoid arthritis is the other type of arthritis that we want to talk about. Rheumatoid arthritis is an immunologically related arthritis. It's very similar to lupus. There's some people, when some people do have rheumatoid arthritis, it can really mimic the same symptoms of having lupus. But rheumatoid arthritis and lupus, these are two arthritic conditions, and they're immunologically related, which meaning it has to do with the immune system. Something is wrong with the immune system. The immune system is overreacting, that causes this type of arthritis, and then you get a lot of inflammation in the joints, like very, very difficult completely different from osteoarthritis. With rheumatoid arthritis, the joints, your fingers, your toes, your knees, your arms, they're so painful and so swollen that it's so difficult for you to do anything when you have a flare-up of rheumatoid arthritis. That is the reason why the drug of choice would be a steroid-based drug. And this is exactly like prednisone or prednisolone. You take maybe 5 to 10 milligrams of prednisolone, and in 5 or 10 minutes, all the pain disappears. This tells you that this drug works extremely well for on the symptoms of the problem, but not get into the root of the problem. And there are not too many rheumatologists who are very much aware of the true origin of these diseases, still baffling scientists to understand how the immune system works. Many of them might say that it is too much of prostaglandins, and the body is not producing enough anti-prostaglandins, and so that might be part of the reason. But I'm going to leave that to the scientists. Let us concentrate on most of the symptoms that you probably might be experiencing and what needs to be done about it. As I mentioned, if you're having lots of pains, especially for rheumatoid arthritis and lupus, 99.5% of the time you would be prescribed some type of steroid-based drugs. And so that would actually give you some relief, because it shuts down the immune system, and it actually put a little halt. It put the brakes on the inflammatory condition, or the immune part of the immune cells that are producing inflammation. It puts a hold on it. So that is the reason why. And again, this might have some very negative effect, because if you're taking prednisone over a very long period of time, there's a lot of serious side effects, that it leaches your calcium out of the body, and so your bones and everything becomes very brittle and very weak, and it has its own other forms of side effects. So those two conditions, lupus and rheumatoid arthritis, these are immune-related type of arthritis, completely different from osteoarthritis, which comes along with age, and also specific female hormones that might be very much reduced in the body, leading to these kind of conditions. The other one would be gout. A lot of people suffer from gout. Gout is very common among a lot of people. I mean, and gout, when you have gout, the place that it really affects you more is in the big toe. So you might find pain in the big toe. It might be swollen, and very difficult to walk, and sometimes in the ankle, and also in some of the other joints you might have a bout of gout. Now, gout is caused by high levels of uric acid, and this uric acid in the body is what actually triggering this inflammatory condition, and also interfering with proper blood flow and circulation. So if you're suffering with gout, there one drug that most doctors would prescribe. I'm not privy to tell you that name of the drug. If you're suffering with gout, then you need to see a doctor, but I do know the drug, and it's not my place to tell you here. But gout is a type of arthritis, but gout can be easily treated. And also with diet, you need to reduce a lot of your red meat, and a lot of foods that are very high acidically based foods, and you need to make sure that your body is more alkaline. And so, being alkaline, you will find that your gout would subside. So this drug, there's a special drug that is being prescribed by many doctors for gout, and this drug would also help to alkaline the body. As a matter of fact, this drug is even given to people who are suffering from renal failure or kidney disease, because we know with kidney disease and high metabolic acidosis is one of the main reasons why the kidney gets to a very bad state. So there is one other problem that is related to high levels of uric acid in the body, and it's called acidosis metabolic acidosis is the name. Sorry, it is called metabolic acidosis. This can actually cause serious damage to the kidneys, and that is why it's important to get that under control. So this same drug that has been used for gout is also being used for people who are suffering from renal failure or kidney failure. So because of metabolic acidosis, this is one of the main reasons why this drug is being administered. So again, remember the name, metabolic acidosis. This is a condition that affects the kidneys. There are other natural formulas that you can use, but I'm not going to mention them here because, again, the program is not for you to prescribe or to give you information to prescribe anything. This program is to help you, to educate you so you will understand how to take care of your body.